That's where it started with families, parents of children with mental illness. And doing 37 years ago, we were talking about families of adult children. Because we weren't even engaging then with the younger children. We were still whispering about small children, although we know they had behaviors. We weren't calling them mental illness. We still were gun shy about using those words. But I think one of the biggest things that I think we need to recognize and give NAMI credit for, it was NAMI, the national organization, 40 years ago, who went to the mat to insist that mental illnesses be considered a biological brain disorder, which meant that for the first time, insurances would pay for mental illness. Now just think about that. We're talking about 40 years ago. If you had a mental illness, your insurance company did not cover that. Medicaid was not even on the table. So that was one of the reasons that people suffered in silence and whatever, because it was then that it became a medical entity, and therefore you can claim it on your insurance. And even that was a dog and pony show, because they only said you could have 30 days, or they would give you so many days. And what did people do? Jockey around trying to find insurances to keep themselves insured. But we've moved beyond that, but we still have other issues, and I think we've talked about some of them today. You may have insurance now, and you may have Medicaid now, and you may have funding now. But in my opinion, services are still not there that we need. And that's the battle we needing to be fighting right now. So as I was listening, I was recapping, and I'm going to start with you because you were the last one when you were talking about the officers' training. I've heard that a lot, that they're only for volunteers. I personally, and some of the people in my line, believe every officer needs to be trained to know what he or she is looking at when they come upon a person with mental illness. I know the ramifications. I've talked to not this mayor, but other mayors, and in fact, NAMI was one of the beginning entities that pushed the police department to even look at having crisis intervention teams. But for me, that's just my bias. It should be a part of their orientation. And especially, I don't know if you want to address it to me now, but I'll let you go ahead.
I was just going to say quickly, they do have training. It's just the crisis intervention is more extensive.
I know, and that's what I wanted to say. Especially, and I guess you may be aware of this tonight, but I'm putting this on the table. Just most recently, with the 2019 budget, they're talking about putting more officers in the community. So when they come, they want to arrest people along with a peer specialist. They will make a determination that the person shouldn't go to lockup, but should go to care. So that officer needs to be trained to know what he or she is looking at before he or she can make that determination. That's in the DC budget for 2019, but they're going to do that. That's what Dr. Roche just put out there. One of the things they're going to do to keep people out of lockup where they may not be getting the treatment they need. So there's always new things coming down the pipe which we need to be ahead of. That was one of them. The other thing that I heard we were talking about is religion and how the church is engaged and not engaged with mental illness. Has always been a problem because years ago when we first were talking about mental illness, if you had talked about religion, the psychiatrists were saying you have religiosity. So they discounted, didn't want to hear that. But as we move forward, we learn new things, hopefully and gladly. Now we learn that many people's religion should be a part of their case plan, should be a part of their preparation for their recovery, because it is an important part of who they are. So you just don't disclose it, you don't hide it, you include it in its appropriate fashion.